Welcome back to Healthy Living for Life. We're continuing our discussion about health information exchanges, or HIEs. We're joined now by Dr. John Griffin. Thanks for being here, Dr. Griffin.
My pleasure.
So you are, and I'm going to look at your title, the Chief Medical Innovation Officer at St. Peter's Health.
That's right.
So Mountain Pacific views itself as being innovative. In fact, one of our visions is to be a go-to resource for driving innovation in healthcare. Your title intrigues me. What is it you do at St. Peter's Health?
I do a little bit of everything. I'm kind of the doc that you cannot put in any box. Right now, technically, what that means is that a lot of our ancillary services, as well as IT, report up to me. And our job, in lots of ways, is to recreate the technology platform of St. Peter's Health. Our vision at St. Peter's is to be gold standard in healthcare in Montana by 2025. And in order to achieve that, we've got to have a gold standard health information technology platform. So that's my job.
So I understand that St. Peter's Health recently affiliated with the University of Utah Health.
That's correct.
So talk about patient records. Are you able to share records from St. Peter's Health with the University of Utah system?
Oh, it's a great question. No, in fact, we aren't at this point in time. Health information is exchanged primarily through fax. We've spent hundreds of billions of dollars on health information technology in our country, and we are still the only industry that is using fax as our primary way to exchange information.
Wow.
Yes.
The old-fashioned way, right?
There are a lot of complexities with health information, high degree of security and privacy concerns that have been limitations with regard to the way that we're using things electronically. It's not like we can just send an email with somebody's health record attached to a different facility. It doesn't work that way.
That's where health information exchanges come in.
Correct.
So do patients have to give consent before their medical information is shared between two organizations?
Yes. So patients always have the right to control what happens with their health information. And so if our patients say, no, we don't want our records to be exchanged, well, typically if we were going to refer a patient to the University of Utah for a consultation, and the patient did not want their record sent, then that consultation likely would not happen, because health professionals need information about their patients, obviously, to make decisions. But the patients always have a right to control what happens or does not happen with their health information.
So as a practicing physician, are there times when you know patients could have received better care if organizations had the ability to share information freely and safely?
Absolutely. Without question, there may be circumstances in an emergency room, for instance. If a patient shows up and is not fully conscious and decisions need to be made in the moment, and if a patient is on certain medications, there are risks that go along with making decisions without knowing, for instance, all of the medications somebody is taking. There are a host of examples where this could come into light.
Talk about how a patient's information is shared confidentially with a HIE.
Sure. Right now, when a patient will be seen at any hospital or clinic, most hospitals and clinic, now we have what are called electronic health record systems. Those are, it's an electronic way to capture information about a visit, the note from the visit, laboratory results, imaging results, and those records are stored on servers that are typically in the basement of these hospital systems. Some are based in the cloud. This is the way technology works. And it is up to us within each facility to monitor and guard the privacy and security of health information. There are lots of risks that we face. It's not typically hackers from China, for instance, that may be trying to get into our records. It's people being not as attentive if they've got somebody's health information pulled up on their screen. There are a lot of human errors that go into the protection of health information. And so in addition to putting up all of the firewalls and encryption layers that protect from outside attacks. Of course, you hear about things that you receive in the mail. If you open up an attachment that's got a Trojan or a virus of some sort attached to an email. So again, those are teaching our users to be careful and protect health information. So there's lots of things that we do within our individual organizations. When you start talking about health information exchange, we're combining record systems from different organizations into one place. And so it's a different level of scrutiny, but there are different risks that go along with that as well. And so the health information exchange organizations typically have a much higher level of security than any one individual medical facility has.
Thank you so much for sharing that information. And thank you also to Dr. Berner for sharing information about health information exchanges. I'm Sarah Medley. This is Healthy Living for Life, and thank you for joining us.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Special thanks to Fire Tower Coffee House and Roasters. Production facilities provided by Video Express Productions.